In traditional Chinese medicine, or TCM, practitioners say the pulse holds all the answers. Its beat provides critical information about a patient's condition. Letitia Chan and her husband, Eric Lam, are nurses in hospitals that practice Western medicine. But Chan is also a patient at this TCM clinic in Hong Kong.
我之前應該係喺我讀大學嘅時候開始睇中醫嘅，都我諗有10年時間，10年之前咁樣咯。西醫可能喺個治療嘅方案啊，或者用藥方面，我哋大約都知道個概念會係點樣咯。咁同埋啲藥可能喺中醫方面會對我個體質配合會好啲，同埋溫和一啲，所以我就選擇中醫咯。
Chan is one of many Hong Kongers who subscribe to TCM. In a city where East meets West, it is not hard to find Chinese medicine. Herbal ingredients can be found in stores and on pharmacy shelves, and restaurants serving herbal soups are scattered throughout the city. While private TCM clinics are abundant, something Hong Kong does not have is a hospital entirely dedicated to the practice. That is set to change with the city's first TCM hospital scheduled to open in 2025. But why has it taken this long? Traditional Chinese medicine as we know it is often attributed to this man. Li Shizhen is a medical scholar who compiled an extensive list of herbal medicines in the 1500s. It outlined how each item could be turned into remedies for various ailments. Those remedies were used to treat a wide variety of diseases and injuries in mainland China. TCM has also been practiced in Hong Kong for centuries, but experts say its development was hampered when the city was a British colony.
Back into the British colonial rule, Chinese medicine was not formally recognized as a formal healthcare system. Later on, the hospital authority was established in 1990. It was well before the introduction of a Chinese medicine ordinance. So when HA actually built a lot of hospitals, Chinese medicine was not included into the hospital system. So for hospital authority, they only include Western medicine. Chinese medicine was not included at the time.
When Hong Kong returned to Chinese rule in 1997, TCM was given official status. A few years later, the city began talks to establish a Chinese medicine hospital, according to a study published by the Hong Kong Idea Center in 2010. Those plans languished for several reasons. One was over a lack of cooperation between different government departments. Another was because investors at the time were unconvinced there would be quick enough returns. So the idea stayed shelved for years. The public had long been exposed to Western medicine under British rule. During that time, TCM was designated a commercial activity and was not given legal medical status, according to a report by the Hong Kong Registered Chinese Medicine Practitioners Association. That greatly reduced its influence and credibility in Hong Kong's medical system.
Things could move faster than expected, but it is what it is. But I imagine that the hurdles for that kind of development, or that the development didn't catch up its pace, could be due to the misunderstanding by the public, and especially by stakeholders, including Western doctors. Even nowadays, even when TCM becomes more popular, I still hear voices from Western doctors saying that, okay, TCM herbs can be dangerous, it's unsafe, it will, hurt your liver, hurt patient's liver, and then leading to like a liver injury or kidney injury.
Another reason TCM has not flourished in the same way that Western medicine has is cost. There are about 10,000 Chinese medicine practitioners operating in private clinics around Hong Kong. In contrast, the city only has 18 publicly funded Chinese medicine clinics. Consultations in private TCM clinics can generally cost twice as much as in Western clinics. Unlike with Western medical care, Chinese treatments are often done in more frequent sessions and over a longer period of time. Additionally, a patient might need to pay for what's known as herb decoction, That is when herbs are boiled or processed into a liquid for drinking. These costs can often be double the consultation fee.
嚟講，我覺得應該都未係好普及化到即係普羅大眾或者係真係基層嘅市民都可以接觸得到，或者係長時間都可以睇得到咯。因為始終即係好似頭先所講政府俾嘅資助啊，或者可以喺政府度睇嘅唔多啦。咁而喺出邊睇嘅中醫，可能每一次嗰個費用都有翻一定嘅價錢喺度嘅時候，可能長遠嚟講對佢哋都會有一個負擔咁樣咯。
其實我即係以前咧就唔係成日都睇中醫嘅，咁原因就係因為我以前覺得中醫係即係睇中醫係貴嘅，即係對我嚟講係貴嘅。
A turning point came during the COVID-19 pandemic. The government stepped up the use of TCM in COVID treatments. Some patients were given generic TCM drugs in anti-epidemic kits and free rehabilitation sessions at public TCM clinics. More residents began to turn to Chinese medicine to treat their post-COVID symptoms. Chan's husband became more enthusiastic about TCM after his recovery from COVID.
我都覺得好急症嘅時候，咁真係睇西醫嗰個療效會快啲嘅。咁但係去到嗰個 COVID 好翻之後咧，因為發覺咳得好犀利，咳咗好耐。咁但係一路食住啲西藥咧，就覺得西藥始終佢嗰個機制都係，譬如你咳就止咳咁樣啦。咁反而我覺得睇咗中醫之後咧，佢幫我可能從個底子嗰度去調理翻嘅時候咧，咁反而睇咗中醫，我記得睇咗1-2次就已經個咳就會冇咗。所以其實即係到而家，其實好多同事可能真係流感好或者 Covid 都好，其實我都建議佢哋好翻之後睇中醫去。即係始終 Covid 係有機會令到你身體有所改變，所以其實可能要從根本嘅方向去治療翻。所以其實我覺得中醫係有中醫佢嘅價值喺度。
The growing support for TCM paved the way for the government to greenlight the city's first ever TCM hospital with 400 beds for inpatient and outpatient services. Construction of the hospital began in 2021 and is scheduled to be completed in 2025.
Also, I think the other very important aspect of Chinese medicine clinic hospital is that it will provide a very comprehensive specialist service, which can cover, for example, internal medicine, external medicine, mainly dermatology. Of course, also have gynecology, pediatric, acupuncture, moxibustion, and also for traumatology and bone setting.
The new hospital will be operated by Baptist University. The university said it would be collaborating with hospitals in both mainland China and Germany. The hospital is expected to serve as a showcase for how Chinese and Western medicine can collaborate. But for now, it will only be limited to stroke cases, cancer care, and pain management. It is not immediately clear how the traditional Chinese medicine hospital will be regulated under the existing medical laws that govern Western practices.